Okay, folks, good morning. Thank you very much for coming out. My name is Tim McMahon. I'm a special agent with DEA out of our Newark field office. I'm going to be the moderator this morning. Again, thanks for coming out. We're very excited to announce the launch of DEA's 360 strategy here in the city of Newark. As you can see behind me, we have 6 speakers for today. To my right, Special Agent in charge of DEA New Jersey, Valerie Nickerson, Newark Mayor Ross Baraka, U.S. Attorney Craig Carpenito. To my left, Dr. Mark Wade, Reverend Hawthorne, and Pastor Pablo Pizarro. Okay, once the speakers are finished speaking, they're going to take their seats again. For the media, after all 6 speakers are done, if you'd like to speak to them individually, you can approach them and they'll answer any questions that you have. Okay? So at this time, it's my pleasure to introduce Special Agent in charge Valerie Nickerson.
Good morning, and thank you again for joining us this morning for this very important announcement. We're here today to announce the launch of the DEA 360 strategy in the city of Newark. We all know there is a serious prescription drug, heroin, and fentanyl epidemic that confronts not only the city of Newark, but all of Essex County. This strategy has been developed to address the heroin epidemic that the state of New Jersey and many others across the country face daily. Our most recent numbers revealed that in 2016, approximately 64,000 Americans died from a drug overdose. And the numbers for 2017 are expected to reach beyond 70,000. This problem is real and requires the best of community efforts in response. Our partners who have joined us here today have committed to the DEA 360 strategy. You see all of them listed here on this banner to my right. The DEA 360 strategy is a multifaceted approach, which includes 3 components. The first component includes increased law enforcement operations, specifically targeting drug traffickers that are responsible for the widespread distribution of heroin and fentanyl in our communities. DEA does one thing very well: drug enforcement. But we recognize that this issue is much larger and more complex, and enforcement alone is not enough to make lasting changes in our communities. DEA will rely and expand upon all of our resources and continue the outstanding relationships we have with our law enforcement allies. More importantly, we need a collaborative effort to include enforcement and subject matter experts in prevention and treatment. The second component of this strategy will be engagement with doctors, pharmacists, and drug manufacturers to develop solutions aimed at preventing prescription drug abuse, which we know has fueled the epidemic of addiction. We know that approximately 80% of heroin users started their addiction with prescription painkillers. The third component of the DEA 360 strategy is prevention and community outreach to our local leaders, clergy, educators, and all interested partners. The community outreach component is critical to the long-term sustainability of this program. To ensure success with our strategy, we must leverage all resources and establish key partnerships with many of you here today. Every community has individuals who dedicate their time to those affected, and we must partner with them in this effort. The current heroin threat is at epidemic levels, and the number of deaths continues to rise. 10 years ago, approximately 36,000 Americans died from a drug overdose. We see from our most recent numbers that figure has almost doubled. Of that number, approximately 2/3 involve prescription opioids, heroin, or fentanyl. While this number is overwhelming, it doesn't even take into account the number of non-fatal overdoses. While we can all agree that Narcan has saved lives, the difference between life and death should not be the availability of Narcan. It should be preventing the abuse of prescription drugs by educating our young people and educating the medical community. It should be education about the dangers of starting on any path of drug use. And it should be in the efforts to aid those already addicted and provide the resources they need to lead a productive and drug-free life. The goals of this strategy are to stop the deadly cycle of heroin and opioid abuse, partner with the medical community and others to raise awareness of the dangers of prescription opioid misuse and the link to heroin. And finally, to strengthen community organizations in order to provide long-term support for drug-free communities. Thank you for your time.
Thank you, Special Agent George Nickerson. Now I'd like to welcome up Newark Mayor Ross Baraka.
Good morning. First, I'd like to thank the DEA, the U.S. Attorney, for being here as well with us, and the partnerships that we have and that we hold dear in the city of Newark that helps us improve the quality of life of thousands of residents in our community. We know very clearly how drug abuse, drug addiction, opioid abuse, heroin has affected the city of Newark for decades, in fact. As a matter of fact, the drug addiction, opioid abuse, heroin abuse, the trafficking of drugs back and forth in our city has not only affected the quality of life, it has raised the constant man hours of police officers in this community, the overtime the city has to pay for police officers to deal with the kind of illicit drug trade, as well as homicides that are associated with it. It is responsible for the increase of violence in our community. The hours that go into the hospitals and medical rooms and treatment at UMD&J specifically, or University Hospital as it's known now. The community is affected completely, almost overwhelmingly by drugs and opioid abuse in our city. Most of the time, folks focus completely just on violence, on the homicides and things that are happening. And most of those things are happening because of their relationship to drugs. So we are excited today to be a part of a holistic strategy with the DEA. They already have a child cares program that we want to work completely with, making sure that our schools are notified when young people are witnesses to traumatic events that take place in their communities and neighborhoods, so that the schools can begin to do something about that, to create opportunities for the institutions in this city to collaborate around making sure our kids are healthy, that they're stable, that they're able to have quality education and they graduate, not affected by the kind of trauma that takes place because of the things that happen in their community that they are not responsible for. Now we have the opportunity not only just to focus in on drug trafficking, to make arrests, to target individuals that are bringing drugs, illegal drugs into our community, and some legal drugs and are dispensing them illegally in our community as well, to focus in on those folks, but also on the holistic side to target young people and community folks around education, around prevention, around making sure that there is no market for this drug abuse and drug addiction, to stop people from going down a pathway of drugs. And we are so excited to be a part of this. In fact, it is right down the alley of the things that we're trying to do in the city right now. We think about drugs and violence in our city as public health issues. We try to address them as public health issues. We try to bring every institution in the city to bear on these problems. So to partner with the DEA, around this is a godsend, and we look forward to this, and we're going to be 100% committed to making sure that this works in the city of Newark. Thank you.
Now I'd like to welcome up the U.S. Attorney for the District of New Jersey, Craig Carpenito.
Thanks, everybody. This is one of the most important things that we do, and I thank everybody for coming out to this today. So I took office on January 5th, 2018, and after evaluating the office for 2 months, on March 5th, announced a reorganization of our resources. And in that's an opportunity, a unique opportunity for somebody in my situation to be able to look at what you have and what really needs to be addressed. And in lockstep with what DEA Special Agent in Charge Valerie Nickerson said and Mayor Baraka, what we want to do, our U.S. Attorney's Office, is better address quality of life issues for the citizens of New Jersey, and certainly Newark in particular, where one of our biggest offices is. So in doing so, we formed a couple of new units and moved some of our resources to address violent crimes and to address the opioid epidemic. As part of that project, we formed what we believe is the first specific opioid unit out of the 94 districts of the Department of Justice. And with us today is Erica Liu, who's sitting in the third row there. She is our first chief of the opioid unit. It's staffed with 6 full-time criminal prosecutors. It has 2 civil enforcement attorneys. It's also buttressed on both sides by what we call our OCDEF unit, which is the traditional drug enforcement unit that the U.S. Attorney's Office has had for over 20 years, that is really geared towards street crimes, and by our healthcare fraud unit, which is a bigger part of fighting the opioid epidemic than most people realize. We're going to fight it on all 3 fronts. We view this as a problem that is not specific to any class. I always say that the opioid epidemic is a problem with many faces. It's your next door neighbor. It's the college student. It's the middle-aged man that you look at every day, go out to their car and go off to their white-collar job that no one knows has the problem. And it is the street person, the lower-income person who's buying street drugs. It's all over the place. It's at every level. And we're going to fight it at all 3. We're going to address the street crime element, the heroin, the fentanyl, the false prescription drugs that are being pressed and killing people at an alarming rate. We're going to fight it with the doctors and the physicians, because for every wonderful doctor we have in this country that's committed their life to making our lives better and protecting people and keeping them healthy and safe, there's someone out there writing prescriptions that they shouldn't be writing. And we're going to fight it in the corporate world too, where we are going to hold accountable corporations and pharmaceutical companies that are dispensing this medicine and make sure they're doing it in a responsible way. And when they don't, if they break laws, we're going to address it. We've had an amazing partnership with the DEA, one of our biggest partner agencies, and you are all blessed, whether you realize it or not, to have Sack Nickerson in that role right now, because she's committed and she's doing an outstanding job. And one of our most important law enforcement partners, the city of Newark. He's not here today, but Director Ambrose has been one of my biggest supporters, somebody that we've worked well with. And by working with these agencies, we've already doubled the number of cases that we've been doing in this area. I think we're up exactly 80% for the year over year in narcotics cases brought by our office. The average number of cases brought last year by our office, 39. In the 3 months since our reorg, 67. We're up 79%. And that's because my folks are working harder. We've redoubled our efforts on this front because we know it's a serious epidemic. And I don't want to leave out our Attorney General, who's not here today, but for the first time in our office's history, we have a memorandum of understanding with Attorney General Graywall, and he has committed 2 full-time prosecutors to Erica's unit to help us share resources and make sure that instead of competing for the spotlight in these press conferences and trying to take credit for everything, we work together cooperatively. We leave our egos at the door and we worry about bringing the right cases and correcting the problem and not who gets credit for it. And he's not here today, but he deserves a lot of credit for sitting with us and coming up with that agreement and committing the resources. So thank you very much for your time. I appreciate everything.
Thank you. Next, we'd like to bring up Dr. Mark Wade, Director of Newark Department of Health and Community Wellness.
Good morning. In just a moment, I'm a little taller than you. I've got to lift this up. I want to echo the thanks to the DEA and law enforcement for your willingness to partner with all of us, the larger community, to address an old problem that's got a new twist. But I also want to say thank you to our mayor, Ross Baraka, who has, in the midst of all the issues that a major city has made addressing this opioid issue a major priority for the city. So I want to say thank you. Again, an old problem with a new twist. Opioid abuse, specifically heroin abuse, is not a stranger to inner cities, including Newark. But it's now become a national phenomenon, because it's penetrated suburban communities that were not as hard hit as inner cities have been over the past number of decades. But there's a parallel track. There is the prescription opioid abuse, but then that's one track, but then there's the illegal acquisition of heroin. And the drugs that lead to heroin abuse. Two separate tracks, and unfortunately in inner cities like Newark, it's the latter, the illegal access and use of heroin that becomes the major opioid issue. We basically have had a dramatic increase in opioid usage. Just in one of our major Newark hospitals, there's been over 500% diagnosis and ER visits due to opioids, an 89% increase in hospitalization. And in one of our major drug treatment facilities, opioid abuse has been the major diagnosis for admission in the drug treatment. So we know that it's a major issue here in New York, and it basically has three major prongs. There's supply, there's demand, and there's treatment. And we have to address all of it. In terms of supply, where our law enforcement has a major opportunity for the family, if you will, and we're a major port where drugs enter. It's cheap, $5 a bag, and it's easy to consume. You can eat it, smoke it, drink it, snort it, and inject it. Decades ago, you could only inject it, but now, any way you want to take it, okay? In terms of demand, we have to ask the question, why is there such a dramatic demand for substances of any and all types? And as a pediatrician, I'm particularly concerned about our young people. What is the message? What are the role models that they're following? You may or may not know, but our music industry has a major impact on our young people. Artists are literally teaching our young people through their music how to access, take, and use drugs. And we have to address the multifactorial avenues that are impacting our children to get a handle on this, of which education is going to be a very important part. And then lastly, there's treatment. And that's what us in the medical profession do. We're up to the task, and most of us, okay, are committed to doing that and doing it right. So I don't want the medical profession to bear the entire burden of the opioid issue. There are good docs out there, and I would say that most of my colleagues are. So together, we can not only attack this, but we can be victorious. We're going to eat this elephant one bite at a time, and if we do it together, we'll get it done on the shorter run as opposed to the long way around. So I thank you and look forward to joining the task force to address this issue for our community. God bless you.
Thank you, Dr. Wade. Now I'd like to welcome up Reverend Anthony Hawthorne from right here at the New Hope Baptist Church.
Welcome to the New Hope Baptist Church. I'm the Reverend Anthony Hawthorne, standing in on behalf of my pastor, the Reverend Joey Carter, and it's really good to be here to speak to, as the doc said, this elephant that we're addressing here. Here at the New Hope Baptist Church, we have been fighting this disease for some 20 some odd years. Like the doc said, this is an old problem with a new twist. It's been around for a good while. And here at the New Hope Baptist Church, my pastor felt a need to service our community when Baxter Terrace was up and the drug trade was running rampant then, and people were still dying quick, fast, in a hurry, and we live right across from it. So we started an outreach program to refer people back and forth to detox and long-term treatment at no cost, and we bunt the whole cost of everything. This has been going on some 20 years now, and it's still in existence. And as you sit here in this sanctuary, and me being a preacher, I can't help but acknowledge the fact that God is going to do everything he got to do to help save his people, no matter who you are. And as I stand here before you, and we look to help, and I want to add that our partnership and our collaboration with the DEA and the mayor and the public officials and the police department, one thing that that's different now, as everybody is looking at it as a human being and not just because you hold the office, because it's affecting everybody. And like they said, we are going to take a holistic approach. And that's like, for instance, when we met and started the partnership with the DEA, I've never, ever heard that the DEA would come down to a level and just identify people without locking them up. Locking them up is not going to be the bottom line. The holistic approach is going to take everybody from every area, from every spirit to get it, because it's affecting everybody. And here at the New Hope Baptist Church, we want to do the best that we can and to have partnership with the DEA. And we have a real mayor. We have a real mayor. He's a real person. He's a people person. He looked you straight in your eyes. He identified with you, and he identified what's going on and what's going wrong in this city. And he has made a great change, and I respect and honor him I don't know everybody from the DEA. I pretty much know Chris, and I know Tim. And I know DEA is by first name basis, and they my people. So I know we're going to get it done. Thank you.
Thank you, Reverend. Now, to conclude, I'd like to bring up Pastor Pablo Pizarro, who's going to speak on a personal story.
Good morning, everyone. I get a call from the DEA, and I'm driving from a conference, and when I get this call, wonderful young lady says, I'm with the DEA, my name is Johanna. And I said, DE what? I said, what happened? Who did what? And she said, we'd like to meet with you and we'd like to speak with you because someone recommended you to us. I said, oh, they recommended you. Okay, they recommended me. And that was the Newark Police Department's community outreach and chaplaincy and street unit that we work with. They told her, you might want to speak to this pastor who's everywhere, and he loves to go into the schools. And it was this chaplaincy unit, it was this community affairs unit that's here today that one day called me and told me, we need you at a school. And this school was in the North Ward on Broadway, and when we get there, they said next to the school, this young lady lives there, and she had died 13 years old due to an overdose of Xanax and pills. Right there I knew it just traumatized me as a father. I said, that could have been my daughter. I have teens. And we spoke to the principal, and we decided we're going to adopt this school. And that, principals speak to each other, just like the police officers speak to the DEA, right? They speak to each other, and they began to say this pastor is working with these schools, and he's working and adopting them, and just going in there and providing support. That's all. Because of this incident, this crisis that happened. And the principal asked me, why do you do this? And this is why I'm here to tell you why I do this, because I've been affected by this. I personally never used drugs. But I want to tell you today that when I saw that young lady, I seen what overdoses can do time and time again. I've walked into bathrooms where my mother would have a rubber band stuck to her. She had track marks all over, and she was overdosing. A young child finding their kid this way is no way that a child should be raised. And this is why I'm passionate about what I do and why I go into the streets. And although I was not raised in Newark, New Jersey, I am from the Bronx, New York, but coming to Newark, I said, this is nothing compared to what I saw. And people ask me, why do you go to the South and the Central and the West and the North? Because I love this city. And I believe that we can help this city with this crisis. And this is the little grain that I can put. And I can tell you that my mother abused drugs for 40 years. 40 years, where what the mayor was saying and what the doctor was saying, and many of the agents here spoke today, is that it's not only drugs, it leads to the violence. And so we knew police officers on a first name basis when they would come to our house. I was raised by my mother and my father to say we hate cops. We don't like them. And who would think that I've been working with them now for almost 14 years closely, and then the DEA calls me and says, we want to speak to you, right? and so when the agent looks at me and says, you probably don't know why you're here, right? I'm like, no. And then I tell my mother, I said, we are going to advocate for those that are going through the crisis you went through. And I want to tell you today that this mother who had track marks, this mother who would abandon us, this mother who almost let us go to the system, which we know here as DIFAS in New York is BCW. This mother whose husband used to beat on her, was an alcoholic and a drug addict, and would beat her. I know that I'm not here to speak about the faith-based component, but as an 8-year-old child, I came into a church just like this, and I said a prayer. I said, God, if you're real, you will heal my mother from this addiction. God, if you're real, you will heal my father from this. And I can tell you the truth right here today that God heard my plea. And it was just the love and support. My mother did it without methadone. My mother did it without any clinics, and not to say that that's not needed, but you know how she did it? By me loving her and embracing her and listening to her story. I seen my father put a fork in her ear and blow her eardrums open. I seen my father hit her with a bat, intoxicated, and blow her kneecap. I should have been a drug addict. I should have been in the streets, but today I'm trying to fight for the very same kids that saw or seen what I saw. And I'm here today to say proudly that because I love my mom enough and I believed in a God that can heal and can save, I'm here to tell you my mom has been clean 20 years because we loved her and we involved her in communities and churches like Daytop Village. I want to introduce to you today my mother who's here clean for 20 years. That's my mom. She rarely goes out with me. The mayor never probably seen her unless he goes to my church. But she's here today to say, we're going to tackle this on, and we're going to fight this, and we're going to do it together. God bless you all. Thank you.
Thank you very much. That concludes our press conference today. I want to give a special thanks to Reverend Hawthorne for hosting us today. I know we all look forward to the partnerships that we formed. You can see from the banner the list of many more of our partners. So we hope with this 360 strategy to make an impact here in the city of Newark. So again, thank you very much for coming out. If anybody has any questions for our panelists, feel free to come up and speak to them individually. Thank you very much.
Okay, so the DEA 360 strategy, as I indicated, is a multifaceted approach. It's a collaborative effort that involves law enforcement, a community outreach and prevention piece, and also the diversion control piece. Newark, in Essex County, has led the stats for drug-related overdose deaths for the past 2 years, but we've also launched this program in several cities throughout the United States as well.
Well, I think that this is a wonderful, unique, and especially wonderful opportunity for us to work with law enforcement in a way that we haven't prior. I mean, the history of law enforcement interaction with community has been an adversarial one, but we need all partners, and law enforcement is a critical piece. So being able to bring law enforcement to the community and start to bridge that huge gap that's been in place so that the community now won't see law enforcement as an adversary, but can recognize them for what they can bring, because they're going to be key to helping to cut off the drug supply into our city. Without them, we won't be successful. But now they also can see, as they continue to work with us, that being the DEA and law enforcement, that we are a valuable part in addressing this issue as well. Again, the demand, the treatment component, education, those are our responsibilities. And so being able to do this, if you will, in a quote-unquote 360 capacity will mean everything for the city of Newark. So I look forward to partnering with them and us working together to address this issue.